This is ED streaming and redirection. It is a system designed to direct patients to the most appropriate care at the right place in the right time frame. The main goal is to reduce demand on emergency departments by directing those patients that do not need to be seen there to a more appropriate point of care. It is intended to be used as a patient-led triage tool, using touchscreen tablets for navigation. When a patient arrives in the emergency department, they will run through a series of questions using the system, which will direct them to the most appropriate route of care for their condition. The system will support and reduce pressure of reception and clinical staff by streaming and prioritising those patients who need to be seen in the ED. Once the patient has been triaged, they will be directed to the most appropriate place to manage their condition. The ED streaming and redirection system is designed to allow emergency departments to decide the best location clinically for each patient. So, you can configure the outcomes to direct specific conditions to the most appropriate local service that can deal with the patient's symptoms. The system calls upon the directory of services to identify services that can manage the patient's condition, as well as ensuring those services have the necessary capacity to cope. The patient can be directed to departments within the hospital or to external services such as urgent care centres, dentists, pharmacies, or their own GP. Where they are sent is up to you and can be as flexible as you need it to be based on the availability of local services in your area. The details of the service will be presented on screen, but they can also be sent to the patient by text or email if necessary. Rest assured, however, that patients in an emergency situation will be told to stay in the emergency department and won't need to go through a full triage, so they can be seen as quickly as possible.